This is Pet Life Radio. Let's talk pets.
And welcome. You're here live with Dr. Jeff Werber here on Instagram, here on Pet Life Radio. Kind of a rush to get here, given the fact that I started my day at KTLA 5 doing a segment on pet safety and Halloween, and had to rush from the studio, which is in like deep Hollywood. For those of you who know the area, Sunset past Gower, where the 101 freeway hits, and had to get back here in about 20 minutes. I kind of made it. So anyway, here I am live. Because it would have been really tough to do it there. You know, I wouldn't have my setup. And anyway, not easy. But it was a fun segment, great segment, actually. And just talking pets, talking Halloween, which obviously we're going to talk about here as well. But let me see any questions to start the morning. Oh, B, I'm glad Archie is doing better. And I'm seeing Steve here, my sister and brother-in-law are on. And so Steve is one of the 9 of us that went on that river rafting trip, the whitewater rafting trip to the Rogue River in Oregon. And we all had a blast. It was amazing, fun time. But, you know, everyone says, oh, my God, be careful. And you say, come on, it's no big deal. Well, most of us were thrown out of the kayak at one point or another. But what was so frightening is about, 2 weeks ago, our circle went around email with an article at about a 46-year-old guy who sadly passed away on the Rogue River, the same river we were on, doing the same rapids, going through the same places. And all the warnings that we get, if you fall out, you got to get your feet up right away because you can get stuck on a rock. You can get lodged between rocks at the bottom. And apparently that's what happened to this guy. And they couldn't get him out in time. And he couldn't. And oh God, when you're in that water, the rapids are so strong. They are literally pushing you. So the more they're pushing you forward, the more your foot, whatever, can get lodged and tightened in between those rocks. And then to have the wherewithal of trying to, hold your breath, go down, you can't see anything. And anyway, it was just frightening that it was at the same river, that same place. And only a few weeks after, maybe not even a week or two after we were there, next time I'm not doing the kayak. I'd love to do it again. It was really fun. We had a great time. But I don't have to, at this point in my life, do I need a kayak that badly? So I think I'm going to hold back. But anyway, it was very, very sad. And the guys on our group that led us also mentioned years ago, there was a younger girl that also fell in and they couldn't get her out. So pretty frightening, but it's not going to stop me. What causes an aural hematoma? So basically, aural, A-U-R-A-L, means ear. And so a hematoma, so basically the ear is a flap called the pinna. And inside that, both sides, the front and back of the pinna, the inside is the hairless side. The outside has the hair. And those two, the front and the back side, are almost glued together. There's not a lot of them. You can't separate them. You can't lift them. Occasionally, when a dog either has an infection, scratching very aggressively, or sometimes when it's just shaking its head and hits the ear flap, you see slow motion, those ears are flopping or back and forth, then you can hit something and you pop a blood vessel. Now, so what happens is there are many, many, many blood vessels. The ear itself is extremely, extremely vascular. So what happens is the blood really doesn't have a lot of place to go. So it separates, it fills up and 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 fills up until it causes a separation between the front and back part of the ear. And there's no way to find the bleeder. So what ultimately do, we drain it. We often do. And 98% of the time it's coming back. And I always tell owners that too. We can try draining it. Most likely the odds are against you, but it's worth a try. No downside. And so it comes back. Then we have to do a surgery. And since you can't really find the bleeder or bleeders that are supplying this blood to this hematoma, so what we need to do then is we need to completely eliminate the dead space. So you do what's called mattress sutures, sewing the back to the front together so tightly that there's no place the blood to go. And finally, obviously, it'll clot. Now, you might ask, is it dangerous? The hematoma itself is not dangerous at all. So why not leave it alone? That's the good question. So the reason we don't leave it alone is the following. This is blood, okay? And in it is you have your blood cells, you have the plasma, and you have fibrin. Fibrin is the meshwork for clotting. And there's no predicting how or where this fibrin is going to settle. So yes, ultimately the blood will resorb. the blood cells are going to die. The plasma is going to resorb. What's left is fibrin. And if you ever seen a wrestler, right, with what they call cauliflower ear, and they're the ugliest ears on the planet, okay? And that's why now all wrestlers wear those ear things, those covers to protect their ears, because they get pulled, they get all sorts of different things, and then they bleed inside, and it's the same thing. So what we do is that because we can't predict, and I've seen some cases where the ear is contorted, it looks terrible, and it gets super thick, and there's no predicting right over the opening. And now you have occlusion, and you cannot get through down into the ear canal. You have a dark, moist area, perfect for bacteria, perfect for yeast, and you're going to have chronic problems. So unfortunately, leaving it alone is not the best choice. Now, if the hematoma is only at the way tip of the ear, then regardless of where the fibrins, if you don't mind a funnier looking ear, maybe a little twisted, then that's okay. But if it's the entire canal, the entire pinna, you do not want to take a chance. You definitely need to fix it. So I hope that answers your question. And let's see, a little waving. Hello, Jill. I was at the studio. That's why I couldn't do our call this morning. All right. 15-and-a-half-year-old Jack Russell Terrier got diagnosed on Thursday with vestibular disease. Lost your balance at the hospital for a day on a cure center for 4 days. Okay. I love this one. Idiopathic vestibular disease. It just happens. Usually it's older dogs. And I remember getting a call from a client of mine. This is years ago. I was at a conference in Orlando, the veterinary North American Vet Conference, now called VMX. I'll be going this January again. And I get a call from this guy. And I mean, he's not just any client. He's a client, of course. But he also happened to be one of the top people at CAA. So a pretty powerful man in Hollywood. And he tells me that he lost his dog. That's what he said. Look, we lost Norman. I go, what do you mean lost? He goes, well, he's here, but he's not here. He's glued to the ground. Okay. He cannot get up. Every time he gets up, he falls over. He tries to get up. He doesn't want to move. And I said, And Norman was a Labrador. So I said, to me right away, that's on my list. Sudden onset. They all of a sudden just looks like they're glued to the ground. They can't get up. They're twisted. Their head's turning. So I said, do me a favor, grab him by the ears, look him dead in the face, dead in the eyes. Tell me what his eyes are doing. And he said, well, God, they're flickering back and forth. There's my answer. We call that nystagmus. And when you have an acute sudden onset of this behavior, this vestibular unbalanced, imbalance, ataxia, meaning wobbly, looks like they're drunk, and their eyes are flickering back and forth, that is diagnostic for IVD, idiopathic vestibular disease. And unfortunately, there's no treatment really. You can use Serenia, which is an anti-vomiting. You can use like anti-nausea too, because some can get nauseous because their heads are spinning. You can use Bonine, Meclizine, like a travel sickness medication. Some people try steroids to decrease inflammation. If there is any, we don't know. Bottom line is, it goes away. So here I am, 3,000 miles away, telling one of the most powerful guys in Hollywood, leave it alone. Don't worry. I didn't send him to emergency. This is before we had video. I mean, I was on a cell phone, yes, but we didn't have all these fancy things. I didn't have AirVet. I couldn't talk to him and see the dog. People thought I was nuts, but I'm not nuts. I mean, there's certain things you just know. And sure enough, in a few days, he was doing just fine. So, but anyways, it was funny. But so if it idiopathic vestibular disease, not to worry. Well, let's put it this way. It looks way worse than it is, and it usually goes away. If by 4 or 5 days, it doesn't go away, then of course, yes, should be seen. But if that is the only problem and it came on suddenly, just look at the eyes, stare at them. And if they're going a fast component, slow component. So fast, slow, then that's what it is. So anyway, you can reach me, as you know, you can reach me anytime. Let me know what she's doing, but I'm not that worried. All right, let me see. I was on that discussion. Let me see if I got any other questions. A lot of highs. Hello, everybody. Good. So we did hematoma. Great. So what I want to do now is we are going to talk about Halloween. And I actually brought my goodie bag of tricks. Okay, not tricks, but this is I took a Halloween gift basket bag, and just to go over some things that, everybody should know about. But let's talk, obviously, the first thing that everybody talks about are the candies and the chocolate. And do I think chocolate's a bit overrated? Yes. When I get a call from that 80-pound German Shepherd that ate a Hershey's Kiss, I'm not too worried. But there are potential dangers. Usually the darker the chocolate, the more pure the chocolate, the more dangerous it is. And matter of fact, pure 100% cocoa powder is probably one of the most Then you have baker's chocolate, which is that dark, unsweetened chocolate. That's pretty bad. So what you should do is just in general, this is a good thing to have on your list of websites. You just do a search for chocolate toxicity in dogs, and there's like a chocometer, and it basically tells you the type of chocolate and how much dogs have to eat per weight. So it literally goes 5 to 10 pounds. It gives you the weight, it gives you the type of chocolate, and you can actually figure out how many ounces of the chocolate are going to be dangerous. Now, if you have a problem, if you're not sure, well, obviously going to emergency and you get to wait several hours, you get to spend $1,000, which is okay if you want. You can go to AirVet, talk to one of our veterinarians on AirVet, but you can also just do this thing. And here's my solution. And it's the only home remedy. And by the way, only for dogs. You cannot do this in a cat. There is no home remedy for inducing vomiting in a cat. The good news is cats usually won't eat chocolate, but dogs love it. And so you take hydrogen peroxide. It should be somewhat fresh. I mean, it doesn't have to be like you just bought it yesterday, but look at the label. If it shows that it's past its due date, if it's been sitting in your cabinet for 5 years, it's probably not good. But if it's within a year, 2 years, it's going to be fine. And you want to give orally 1 ml, a milliliter, per pound of body weight. To put it into easy measurements, it's a teaspoon for every 5 pounds of dog. A teaspoon, which is 5 ml, for every 5 pounds of dog, 15 pounds, a tablespoon, that's 15, 3 teaspoons equals a tablespoon. I'm sure those of you that do baking and cooking know that. An ounce typically is 30 ml. So if the dog is 30 pounds, you can do an ounce of hydrogen peroxide. You give it to them in the corner of their mouth. Don't shove it down so they inhale it. You want it, they got to swallow it. And within few minutes, they should vomit. You can repeat it once and only once. If they don't vomit after the second time, then it's time to see that veterinarian. It is effective. Now, there's another home remedy out there using salt water. It is not acceptable. Most of us do not like it. There are other problems with that. Therefore, we do not like having salt. That's why there are certain dogs that have problems if they do so much swimming in an ocean and they drink too much water, they can get brain swelling. There are things you got to be really careful. We do not recommend doing the salt water, but the hydrogen peroxide is fine. Okay, in addition to the chocolate, and here's two of my favorite. Can you see it? Of course, you got Baby Ruth, and we got Snickers. Oh my God, I love them both. If you have any left over and you're afraid your dogs might get hold of them, the simplest thing to do is just send them to me. They will be well taken care of, well eaten, and I'm a talkaholic. Now, but I do worry more about things like this, okay? These are gums, sugarless candies that have xylitol. In fact, I was looking at this one here, all right? And the first ingredient of these, xylitol. Here, gum, sugarless gum. The second ingredient, xylitol. This is dangerous stuff. And it is a potential killer. And if you also understand that there is a product out there that has a different name and you think it's so natural, it's called bark sugar. Well, what could be bad? Bark comes from bark of a tree. That's natural. No, that's xylitol. So I'm so pissed that they name it bark sugar. It really, it makes me angry as hell. Oh, one last thing about the candies, and I brought a sample here, and that is things like this, lollipops. They're going to eat the wrapper. They're going to eat the stick. They're not choosy. They can't open it. They can't unwrap it. They pick up the smell with their amazing noses, and they're going to eat the whole thing. So again, you need to be really, really careful. Next up, you have, kids coming in, the doorbell's ringing every few minutes. Dogs are going to get hyped up. Make sure you have dogs that are okay with it. Make sure they don't try to bolt, because if they bolt or they get scared because the doors opens and these strange looking creatures are at your door, they just want their candy. They don't give a darn about your dog, but your dog sees them and freaks out because they're so funny looking. They don't know. They sound like people. They smell like people, but they don't look like people. And so that's potentially dangerous. So make sure they're wearing their collars, their leashes, ID tags, etc. Home decorations, of course, if you have any kind of flame in a jack-o'-lantern, in a pumpkin, or a candle, right? Or you have decorative lights, be careful. So I brought my little electric cord because you got to be careful of that as well. Because again, they are very dangerous potentially, and animals, cats can bite into them, dogs can bite into them. So I'm always fearful. If you have a dog that freaks out and they freak out, put them in a different room, put them in a safe room. Maybe you can get some natural calming. You can get either I prefer the natural calming formulas. This is one of mine, and this is just called, and you get the name. The name is Chill, because it's a great supplement. You can get it on my website, and it is valerian, passion flower, chamomile, melatonin, all these really natural calming substances, no CBD, and it works extremely well. And if they're really, really bad, then comes the drugs. And there's things like acepromazine, trazodone. Talk to your veterinarian. And there's some things that you can give your dogs. It's almost like when you're going to travel with them, you need to, or any holiday coming up, obviously Thanksgiving's around the corner. A lot of people are going to come over. There's going to be commotion. There's going to be decoration. There's going to be candles. There's going to be chocolate, nuts, raisins, all these things. So again, we need to be very careful. And last but not least, before we go on our break, costumes. Now, again, if you're going to take your pets with you trick-or-treating, understand one thing. Look, if you have good dogs, they love going out. If they love kids, it's great. These aren't regular kids. These are kids that are dressed up like who knows what. And again, to a dog, it's when do you trick-or-treat? You trick in the middle of the day or you trick-or-treat at night after it's dark. So usually it's dusk. It's getting to the point where the sun is going down. And by the time they're done, it's usually dark. The stars are out. So again, it's pretty frightening out there for a dog who sees these groups of kids approaching. From listening, they hear sounds that sound like people they recognize, human voices, but they don't look like humans. And that is the problem. So even the nicest, sweetest dog, if one of these kids tries to bend down and pet your cute little dog, and your cute little dog that's usually so friendly with kids takes a bite, it's potentially a problem. Now, how about the dogs? How about dressing your pets in costume? Again, do I love it? No. But I mean, it depends on the costume. It can't be restrictive. A lot of times when you put things on dogs, even things like a sweater, it bugs the crap out of them. You don't want to do that. So test it first at home before you take them with you, and just make sure they're comfortable. Make sure it's not too tight under the front legs. Make sure it's not too tight around the neck. You don't want to restrict their vision. Remember, of all the senses, the hearing, the smelling, the taste, one of their weakest is their vision. Now you're going to put something over their heads that is going to impede their vision. That's going to make it even worse. So again, it's very important to test it first. Make sure that they're okay with it. If they're okay with it, take them out for a little walk before this. I mean, do it tonight, do it tomorrow with the costume and see how they do. If you're embarrassed, have you been seen in this costume and it's not even Halloween yet, do it in your backyard. Or maybe don't dress them up at all. But that's another story. Look, Halloween's meant to be a really fun time. Kids really like it. And as I said, leftover candies, I'll give you Dr. Jeff at Dr. Jeff or Jeff at airvet.com. I'll give you my address. Very easy to get to me. But anyway, just have fun. So we have lots more to talk about. I want more questions. So while we are going on our quick break, then a word from our sponsors. Let's see, no chocolate at all. That's probably the safest. Then I'll wait for your questions. When we come back, we will talk about some of your stuff. All right, very good. Don't go away. We'll be back in just a few.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life
PetLifeRadio.com.
We are back live here on Pet Life Radio. Just had to unmute myself because during the break, I cannot shut up. So I had to talk to somebody. So I talked to Instagram. So there was a question while we were gone about tests for cancer for dogs. And the answer is yes, there are. There's the oncocanine. There's another one. I don't remember the name. I'm going to find out. And it is used to detect mast cell tumor with high accuracy. And so it's a great screening test to see if, yes, in fact, the dog does have mast cell disease. And that is a very, very, very common cancer that we see in dogs. Oh, so talk about cool new technology within veterinary medicine. This is a new, it's a monoclonal antibody for parvo. So basically, it's the same thing that they've been using testing in COVID, is they're giving a specific antibody for COVID. And it's available. It basically, through all the studies, and it just got FDA approval, as they say, it can shorten the duration and greatly increase survival in clinical testing of parvovirus. And, what happens is 4-year-old box that isn't neutered, is it too late for surgery? Absolutely not. So it's never too late to neuter. In fact, a lot of legitimate breeders, what they will do is after their breeding age of the dog, whether it's a female or a male, first thing they'll do is spay or neuter. Because why risk it? We know there's certain problems, except maybe for the golden retriever, we've talked about that before, that there seem to be more issues as dogs get older with certain cancers that could be preventable through neutering. So, and for male dogs, prostatitis, not a cancer, but it is very linked to testosterone. So my feeling is if you have a dog, and let's say all the breeds, except maybe asterisk, the golden retriever, we'll get into that another time, and you are not using this dog for breeding, and it's just a pet household family dog, then absolutely you want to spay neuter. Now, what has changed over the years is that we are now neutering later. The larger the dog, the longer we wait. The large breeds are known as older dogs to get bone cancer, osteosarcoma. And their studies have shown that there's a greater incidence in these breeds, these dogs getting osteosarcoma as an older dog when they're 7, 8, 9, 10 years old of age, if they were pre-pubertally neutered, meaning neutered before they were fully sexually mature. And since large breeds mature later than their small breed counterparts, then I'd like to wait at least a year. In fact, most dogs now I wait a year if I can. Small breed, twist my arm, 9, 10 months, okay. The problem is that we battle with some of these rescues. We want you to rescue dogs, but the rescues, they are supposedly under a guidance from their local animal authorities as far as the Department of Animal Regulation, the city ordinances, that they can't adopt them out until they are fully neutered or spayed. So what happens is, what do? If you have a dog that's 6 months, so I'll tell you what they do, and it's a little secret, so you can't share it. So if you tell, as they say, I got to kill you, but no. So they're not giving the dog yet. They don't sign the adoption papers, and that family is just fostering the dog. It's a foster, and then, oh my God, when a dog hits 9 months, it becomes a foster failure, and the first thing they have to do now before they let the owner have it for real is neuter. So you got to get around it. I don't like doing, and pre 5 or 6 months, not at all. That I'll battle. Why? Because the smaller breeds, again, this is usually where it comes into play, are commonly will have something called retained deciduous teeth. They're going to have baby teeth that need to be pulled. They haven't fallen out on their own. So the adult tooth comes in and the baby holds its ground. And now you have double teeth, 2 teeth coming out of the same socket in the gums. You got to pull those babies or you're going to have malocclusion. You're going to have crooked teeth. You're going to have some orthodontic problems. So those, I don't like to anesthetize them twice. Now, if you have a very young dog at 4 or 5 months and you already see some problems, terrible mouth crowding, you already see the adult tooth and being malpositioned, then yes, we're not going to knock them out really quickly, pull those teeth, but I'm still not going to do it. And then wait until they're a little older and wait closer to a year of age and then neuter. So, there's a lot to discuss. Large breeds, however, I write letters. It is almost dangerous to neuter them at least before a year. And I said, the bigger the breed, for like giant breeds, the Newfies, the Great Pyrenees, the huge Mastiffs, I'll wait until they're 2 before neutering. But a boxer, never too late for surgery. I shouldn't say that. You have a dog that's 17 years old and he made it this far and he's not in great shape and you're going to anesthetize him to neuter him, then I don't know if that's such a good idea. But we're talking normal circumstances and that would be fine. Okay. Pug is 12 and a half years old and has mast cell tumor and surgery, also biopsies done for the liver, spleen, other things, and it came back good. Her tumor was a high grade. She is on antibiotics. Okay. Now, for this dog, it was a high grade mast cell, and they did staging. That's where they take samples of liver and spleen, and there's no evidence at this time. We still have a very guarded prognosis. However, if this were my patient, it's a pug, doesn't say, her, I would have her on Palladia. Palladia. Talk to your veterinarian about Palladia. It is a phenomenal drug. Unfortunately, along with phenomenal, is a very expensive drug, but man, it is worth it. So again, I had a 15-year-old Labrador. I did surgery to remove a humongous I couldn't even remove it all. Mast cell tumor. It was a grade 3. He staged fine. It was not yet in his liver, not yet in his spleen. We put him on Palladia. 15 years old, Labrador. I mean, first of all, how amazing is having a 15-year-old lab? And Was I nuts to knock out a 15-year-old dog for a 2-hour procedure to cut away as much as I could this disgusting, ugly, bleeding tumor? Of course I was. But his bloods came back fine. I had no choice. I'm not going to put him to sleep without trying. So we did the surgery, and it came back. Grade 3, mast cell, and put him on Palladia after he healed. We had to drain in first because it was an extensive surgery. Took the sutures out. He healed really well. He tolerated the anesthesia really well. And I went ahead and put him on Palladia. Well, he not only made it to 15 and a half, not only till 16, he made it to 16 and a half. And it wasn't even the mast cell that got him at 16 and a half. So 12 and a half to me means nothing, especially in a pug. And I would 100% talk to your veterinarian about Palladia. And it is the most amazing drug for these mast cell sarcomas. In fact, I just had a case of a splenic sarcoma. They couldn't really identify whether it was hemangio or what type of spindle cell, but it was a sarcoma. And I did a consult with an veterinary oncologist. And guess what? She says Palladia. So I've already talked to the owner. We're going to start Palladia. So anyway, it's really the best way to go. Hope that answers your question. Now I'm looking for the question, Martineau, about the chicken. She can't get down or antacid. Boy, you can try to get something in a liquid form or have it compounded. All right. A lot of times we put these dogs on steroids. We put them on an antacid so you can get Prilosec compounded into a liquid, and then you can stick it into a liquid. Or, the pills are so small. If she's eating otherwise, just hide it in food. One thing that I have done that kind of works well, the little treats, they look kind of like cheese puffs, but it's corn puffs called Bamba. And you can get them at Trader Joe's. And you can take the little teeny pill, and the top of the Bamba is a little soft, and you just push the pill inside the Bamba. All right. Then give a few Bombas without anything. And if she eats them and seems to like it, just give that third Bomba or fourth one, give it with the pill inside. And she'll eat it so fast, you won't even know she had the pill. And then the chicken, let's go to New York Yankee. Mr. Chicken question. Let me see. Okay. Serenia for 4 days, wants her back on hydrolyzed chicken, dog food, and she boiled chicken that she loves eating with it. Oh, yes. As long as there's no chicken allergy, 100%. Whatever. The only time we stop anything chicken or chicken byproducts or the chicken meal is when you have a dog, like a lot of Frenchies that have known allergies to chicken. But if there's no known allergy, whether it's hydrolyzed chicken, unless they really suspected, even if you suspected a food allergy, you still don't necessarily want it, even if it's hydrolyzed protein. If there were symptoms on regular chicken, and those symptoms are not seen when you do hydrolyzed chicken, then of course stick with hydrolyzed. But if after feeding regular chicken, it doesn't really affect much at all as far as the GI tract, the gastrointestinal tract, or skin from scratching allergy, then by all means, go ahead and do it. Multivitamins, of course, I'm a big fan. I take multivitamins every day, and I'm a very big fan. All right. Anyway, I think that's all we have time for. I'm getting dirty looks from Mark, my producer. He wants to get out. And I will think, Mark, are you going to BMX at all? You don't know yet. So, well, if you are, I'll be there, of course. So it's not that far for you being in Florida. But all right. And I think that's it for now. If you have anything that I didn't get to, any questions you may have, you can always reach me here on Instagram or on Pet Life Radio. Easy email, drjeff@petliferadio.com, or Instagram, Werbs_DVM. Or if you just put in Jeff Werber, it'll pop up anyway. All right. Have a wonderful, safe Halloween. Again, leftover candies. I'm right here in LA. Please don't be bashful. And I should eat them, but I just like them too much. The reason why I don't eat them so much, I don't buy them. I just don't. It's like ice cream. If I have ice cream in the freezer, it's getting eaten. If I don't have ice cream, I can't eat it. I'm not going to go and buy it. So anyway, that's my secret. Okay. I think that's it. So any other issues, questions you have, just send me during the week. Otherwise, next week, here, same bad time, same bad channel, here on Pet Life Radio, here on Instagram Live. Looking forward. Have a good week. And safe Halloween. Have fun.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.